Welcome to Transcend Awards. Prioritize infection awareness. Your learning objectives are to understand the definition of infectious disease, to understand the causes of infectious disease, to understand the transmission of infectious disease. Once you know these, you can make informed choices to help you to prevent contamination and spread of infectious disease. Infection defined. Infection is the invasion of disease-causing agents, also known as pathogens, into our body. Infection is the result of the multiplication of pathogens in our bodies, the reaction of our body tissues, and the toxins they produce. Infection from a non-communicable disease is one which cannot be passed from person to person, such as heart disease, cancer, chronic respiratory disease, and diabetes. Infection from a communicable disease is known as infectious disease, which means that the disease can spread from one person to another. Infectious diseases affect people worldwide. Symptoms range from mild to severe, and treatment depends on the cause of the illness from the host known as the pathogen. Infection pathogens. There are 5 main pathogens that are the cause of infectious disease in humans. These invaders are categorized as bacteria, viruses, fungi, prions, and parasites. Infectious diseases are caused by these invaders, which are all around us. Transmission refers to the way in which infectious disease is spread. It's important to understand how these diseases are transmitted to protect yourself and others. Infectious disease transmission. Direct contact transmission. Infectious diseases are commonly transmitted through direct person-to-person contact. Transmission occurs when an infected person touches or exchanges body fluids. This can happen before an infected person is aware of the illness. Pregnant women can transmit infectious diseases to their unborn children via the placenta. Sexually transmitted diseases, STDs, can also be transmitted this way. Contaminated object transmission. Infectious diseases can be transmitted through contact with contaminated objects. Some infectious agents can live on objects for a short time. The time frame differs across infectious agents. Where this is the case, if you touch an object, such as a doorknob, soon after an infected person, you might be exposed to infection. Transmission occurs when you touch your mouth, nose, or eyes before thoroughly washing your hands. Airborne transmission. Some infectious diseases can be contracted simply by breathing. These are called airborne diseases. This is as a result of certain infectious agents which are made up of small dry and wet particles. These stay in the air for long periods of time, allowing airborne contamination even after the departure of the infected person. Contamination occurs when we breathe in the infectious agent. Droplet transmission. Some infectious diseases can be transmitted through droplets of spray from our mouths. This occurs when we breathe, talk, cough, and sneeze. Certain infectious agents are made up of small and usually wet particles that can stay in the air for a short period of time. Transmission occurs when we inhale the droplets or when we touch our eyes, nose and mouth with infected particles that has dropped onto our clothes or hands. Contamination usually occurs in the presence of the host and within 2 meters of them. Fecal-oral transmission. Some infectious diseases can pass from one person into the mouth of another person. The main cause of fecal-oral disease transmission is lack of adequate facilities and poor hygiene practice. This can be as simple as failing to wash hands after the toilet and then touching the face and mouth. Food transmission. Some infectious diseases can be contracted through food or infected vegetation. This can occur when food is not cooked properly, where hygiene when working with food is poor, or where the vegetation is contaminated. Waterborne transmission. Some infectious diseases can be contracted through contaminated water or soil. These can be transmitted through bathing, washing, drinking, or by eating food exposed to contaminated water or soil. Animal-to-person transmission. Some infectious diseases can be transmitted from an animal to a person. This can happen when an infected animal bites or scratches you, or when you handle animal waste. Zoonotic transmission. Infectious diseases between animals can sometimes transfer to humans. This occurs when an infectious agent has jumped from an animal to a human. Typically, the first infected human transmits the infectious agent to at least one other human, who then infects others. Insect transmission. Some infectious diseases are transmitted through insects and known as vector-borne diseases. Some zoonotic infectious agents are transmitted in this way, especially by those that suck blood. These include mosquitoes, fleas, and ticks. The insects become infected when they feed on infected hosts. The disease is then transmitted when the insect bites a new host. Infectious disease awareness. Because infectious diseases can spread through direct or indirect methods, everyone is at risk of illness. It is important to recognize that some people are at higher risk due to their personal health, home, or work environment. It is also important to recognize that every infectious disease agent is different, and transmission, signs, and symptoms differ for every infectious disease. Taking the time to understand the different infectious agents and associated diseases can help you to prevent, mitigate, and manage any effects. Thank you for watching. Feel free to watch as many times as you need, or move on to the next part of your digital learning experience on your list.